Summit Housing and Outreach Programs has been involved in the Health Equity Project for 4 years as the lead agency, and in the past 2 years we've been working on the health equity data collection phase of the project.
OneLink started as one of the pilot sites in July of 2015, where we started asking at point of screening.
At ROC, we're a client-centered organization, so all of the services that we provide, which are mental health services for youth, children, and families, centers around that circle of care piece. And health equity then is just one of the lenses that we look through in order to provide the best service we can for kids, youth, and families.
Nucleus has participated as an early adopter in the implementation of the 8 core questions, and we've been really fortunate in terms of having the opportunity to send many of our staff to the training, because the training continues to happen as the project evolves. And as we bring in new employees or as we build our capacity, we're able to have more and more of our staff trained in the health equity questions. As an organization, we've integrated health equity in the fabric of the orientation. So one of the very important elements of the training is that it allows the staff to develop a level of comfort with the questions. In the beginning, when staff are introduced to the questions, there certainly is a level of discomfort because they are questions that they may not be comfortable asking, and that discomfort is transferred to the consumer answering the questions. What the training does is get staff to develop that level of comfort asking the questions so that they don't feel like they're prying. They're not introducing the question in a hesitant way, but making it very comfortable for the consumer to respond. Part of our journey with the Health Equity Project has been to have regular meetings. So on a monthly basis, our Health Equity Committee meets, and we use the Health Equity Impact Assessment tool as a springboard to guide our discussions. It allows us the opportunity to explore the impact of some of the services that we provide, the unintended consequences related to the social determinants of health, and really try to identify opportunities for improving access or guiding our consumers to the resources that they need.
Also, the community of practice was also a really important benefit because it really connected us with the other agencies and continued our learning, as well as an opportunity to mentor other agencies.
The web platform is also a great resource for sharing some of our successes and really learning from others, gaining access to materials they might have developed or tools that help with the implementation.
So once we'd had an opportunity to look at the analysis of the data and the data itself, we found that the clients that we were serving weren't necessarily representative of the diversity in our community. We found that a lot of the clients were straight white males born in Canada with a low income. So as an agency, when we saw the data and saw the clients that we're serving, we began to have some conversations to see whether this is in fact the client population we want to be serving, or whether we should be trying to reach out and reach a more diversified client group.
So I think what it does from an organizational standpoint is it really gives you an opportunity to see who you serve and who you're not serving. So for planning, so when we implemented our new funding allocation, it was through the lens of who we're not serving that we were able to fill that gap.
In response to the trends that we found in our data and looking to try to diversify the clients that we reach out to, we've started to look at our strategic planning for the next 3 years and incorporate some of the findings from the trends of the data into our strategic planning. We're all here to learn. So really, for us to be able to learn from each other, you have to honestly look at the data and share the data as it really occurs.